I worked with Dr. Jenkins for 39 years. He was a wonderful man, and I would say with a big heart. He never turned a patient away. He dedicated his life to his profession, his patients, and always taking care of the underserved.
It's a blessing, I think, in a lot of ways to be able to work and practice in this community and also in Dr. Jenkins' clinic. Dr. Jenkins is a revered community pillar. We do a lot of work not just with the patients, but also with their families in helping them get the right resources they need.
My father was a practicing physician for roughly 50 years, from the early 1960s until 2012. And throughout that period, he had the privilege of seeing thousands, if not millions, of patients. It was a commitment to the welfare of the children of the community to ensure that they got the highest quality of healthcare possible, regardless of their ability to pay, regardless of who they are, where they're from. It didn't matter. What mattered was that child got the care they needed.
We were honored to be chosen by the Jenkins family and Dr. Jenkins to keep his practice going. What we've tried to do is take Dr. Jenkins' practice and his ideal of caring for kids in a really positive, high-quality way and put an organization behind it so that LifeLong can then offer the support to keep it going. And we're planning to build over the next couple of years a full-fledged health center that will include the pediatric practice, but will also include adult and family care, urgent care, dental care.
We're having the community and patients give us feedback. They come in and they talk to the architect and the engineering individuals about how they see the facility looking, because it's really important to make sure we're meeting the demands of the community. As we move into the way that we do healthcare, we want to make sure that our patients are involved. And we hope that this facility will be a core part of the community so that everyone can find a health home.
There's a really important reason that we all need to support the development of this center. And this is something my father taught me from a very early age, is that the underserved community with respect to healthcare services, they need an advocate. They need somebody to help make sure those healthcare services are available.
Looking to the future, it's very exciting about the growth of LifeLong in this area and all the additional services we can provide for our patients. The security of knowing that we are here, that our doors are open, that we're actually in the neighborhood. Our patients don't have to get on a bus or the BART to get their medical needs treated. And that speaks volumes. It's exciting because we will be the largest clinic in the area.
I'm compelled to be involved with LifeLong to ensure that the legacy of my father is preserved. The biggest concern that I always had throughout his career is that day that he stopped, what would happen to the thousands of patients who relied on him for care? By working with LifeLong, by creating this health center, we're creating a permanent center, a permanent source for the highest quality healthcare for the members of this community. So that concern of mine will be one I'll never have to worry about again.
Thank you, LifeLong.
Thank you, LifeLong. Thank you. Thank you. Thank you, LifeLong.
Thank you, LifeLong.